Hello friends and parents, thank you very much for coming back. As you can recollect from my previous video, I talked about oral health care, what are the components of oral health and what is the importance of oral health. Today I am going to talk with you a little about what can go wrong in your oral health care. It's not that we all don't take good oral health care by ourselves, because you see, your oral health of the teeth, the gums, the periodontium, the muscles can become diseased for no fault of yours. Or sometimes it can happen because we neglect it and because of the modern diet. Now you see, the diet that we are eating these days is not conducive to self-maintenance of the oral health care. Previously, when people used to use raw food, there was a frequent self-cleansing mechanism because of certain fibrous food which was in our diet. Now because of a more refined, more sticky diet that we are having, we may end up having dental problems in spite of having a good oral health care done by ourselves at home. And to just maintain or mention a few of the dental ailments and the diseases which can occur, the most prevalent dental disease in the whole world is a non-communicable infectious disease which is known as dental caries, and that is the teeth getting decayed. Now that happens because of a mixture of many things, and many things need to act together for that mechanism to happen and to decay your teeth. The primary thing is a food substrate which is rich in carbohydrate like sugars, microorganisms, the tooth structure and the pH of your mouth. The pH means how much acidic or alkaline your mouth is. These are the four factors. We will be discussing this about this web of the dental caries when we talk about prevention in the subsequent videos. But today I am just mentioning what is dental decay and what it takes to decay your teeth. The second problem which we have is the gum related problems. Our gums can sometimes start bleeding because of food lodgement or maybe because of irritation. They can become swollen and they may entrap more food because they are swollen and there are more pockets which are formed. And when the infection from the gum spreads into the periodontium, which is between the joint, between the teeth and the bone, and when the joint gets diseased, the tooth gets something known as the advanced stage of pyorrhea, or which we also scientifically call as periodontitis. Now this periodontitis can loosen your teeth. It starts from a small mobility, which we call it as a grade 1 mobility, to a high grade of mobility, and slowly the bone structure is lost and your tooth might be lost. Similarly, when you have a dental decay, as you all know that the tooth structure is made of enamel, dentin, and the most core structure is the pulp, which contains all the blood supply and the innervation and the sensations for your teeth. Now when the decay is within the enamel, it will frequently not give you any complaint. When the decay increases, the most common complaint that we have is the food lodgement. Food gets stuck in the cavity. When it goes deeper down into the dentine, which is the sensational area of the teeth which has got sensations, you might start feeling sensitivity, or you might start having some tooth pain, or some people don't have a tooth pain. And when the caries reaches the pulp, and when the pulp gets infected, then the tooth, at times the pulp becomes dead, and then we have to do a procedure known as root canal treatment, which you must have heard about before. The other problems includes diseases of the muscles, of the skin, the various problems which occur because of tobacco chewing or because of smoking or because of some other bad habits. When the mucosa becomes, or the inner skin of the mouth becomes diseased, and it can become from a benign tumor or a swelling that it become a malignant cancerous, which we frequently call as oral cancer, and the oral cancer is frequently on the rise these days. Many patients also have problems with their joints here. When the bite is not proper, as I talked in the previous video, the bite is the occlusion, the way the teeth meet, and they should be perfectly meeting. The teeth should be neatly arranged and they should be biting properly with a good occlusion. And when that doesn't happen, it produces abnormal forces on the teeth, on the supporting structures of the teeth, and on the joints and the muscles. And all can get disease because of that. They all can get affected because of a bad bite. So these are the various dental ailments on a broad spectrum. And you wait for my next video where I am going to tell you how at home you can take good oral health aids which are available and which you can use at home and prevent certain dental diseases. Having said that, let me tell you, as I said in my first video, it is very imperative that you see your dentist regularly, because dental diseases are silent to begin with, and you may have a dental disease with no complaints. So please visit your dentist regularly, once in a month, once in 6 months to once in a year. Till my next video, thank you very much. See you guys.